Hello and welcome to Resilient Living TV. This is the place to be when you're ready to create a remarkable life through change and resilience.
Today's episode is offering some insight into the lingering effects of sexual violence. Now, we only have to look at the news or read the trending post in social media to realize that there is a lot of sexual harassment, sexual assault, sexual abuse, sexual violence that is going on in our society. So I wanted to concentrate on this and discuss this and get a dialogue started on what really is expected of a victim. Do we really understand the lingering effects of sexual violence? So I want to talk about three main things that victims are suffering from due to a sexual violence episode or experience. Okay, so when it comes to sexual violence, most of the scars are on the inside. Sexual, physical, and emotional abuse can have a profound effect on your overall well-being. The trauma can even trigger clinical depression, which is a serious health disorder, mental health disorder. So it's not only depression, it's also flashbacks and PTSD, and I want to address these three in particular. Okay, so let's look at depression. It's normal for survivors to have feelings of sadness and hopelessness. You know, I felt that no one believed me, even telling my mother about my experience with her husband, even explaining to one of my bosses that I had experienced a date rape. I was fired on the spot. So people have a problem accepting that you are sharing something so traumatic with them, and they may not be able to deal with it. So you feel guilty, you feel the shame, you feel that it was your fault in some way, because people sometimes re-victimize the victim when they come forward with what they're going through. So the hopelessness kind of sets in. But if these feelings persist for an extended period of time, say maybe a couple weeks, it may be an indicator that you have depression. And it's not a sign of weakness. And it's not something that you should snap out of or just get over. When someone tells you that, just kind of take that with a grain of salt and you get some help, because people, when they can't deal with it, that's their issue. What you need is someone with a listening ear, someone who can help you, who understands what you're going through and can offer assistance for your healing and your growth. Okay? Now, what are some of the symptoms of depression? It's again, a feeling of hopelessness about life in general. And that detachment may be self-inflicted. You may be pulling away because you don't feel comfortable around people. You're trying to deal with your own situation. And you may have trouble concentrating, so you may not even be able to perform at your highest potential because you have all of this that you're dealing with. So I know, because I suffered for 6 months with depression. And I realized that, during the day I'm all happy-go-lucky, I'm cracking jokes and I'm smiling and laughing with the people I worked with. But when I got home, I was an emotional wreck and I cried myself to sleep for 6 months until I realized this is no way to live, and I sought help. So I highly recommend, if you have depression for longer than a couple weeks, don't let it persist. Please get help. See a medical doctor, see someone. On my site, there's a link below, but on my site, there's a list of crisis resources that are available as well. So now let's look at flashbacks. Now, flashbacks is when a memory feels as if it's taking place in the present time. For someone who has suffered a trauma, it is difficult to realize when something is not real, because it's as if the experience is happening all over again. The trauma is happening all over again. And the person that caused your pain is present. At first, the flashback may even seem random. However, it can be triggered, and triggered by something as simple as a scent or a smell, a resemblance to your attacker, how someone touches you, a tone of voice. But there again is help for flashbacks. You can get help from a medical professional, or there is brain therapy that is really helpful, because the trauma actually rewires the brain, and you can reverse this with therapy. And until you get help, you can try these few tips to help you through the flashback. Okay, first, tell yourself it's just a flashback. Now, I'm not trying to trivialize what someone may be experiencing, because it is devastating. But if you can, it's like a bad dream. If you can tell yourself at that time, look, it's just a bad dream, it's just a flashback, then you can help to calm yourself, and you can bring yourself back to the present. Next, breathe. You ever notice that when we're frightened, we kind of hold our breath, or we breathe very shallow. So just breathe. Put your hand over your stomach. Breathe slowly in through your nose. Really slowly count to 7. And then breathe out through your mouth. Count slowly and count to 7. To help you to regain your composure and help the fear subside, and you can calm yourself down. Okay. Also, to help you bring yourself to the present, and you activate all of your senses. Okay. First thing, when you're in a flashback, you're seeing things, you're feeling things, you're hearing things. So actually look around you, and what do you see? Items, people, your pet, the space you're in. That will help you come back to the present time. What do you smell? Listen, what do you hear? Okay, try to drink something that you enjoy, or if you have a glass of water next to the bed, drink that to kind of activate your sense of taste. Also, your sense of touch. It's okay to have something that comforts you, a blanket. It could even be a person. If you're married or you're in a relationship, that your spouse or your lover next to you could maybe help. Your pet. Your sense of touch, something that has texture to it, something that's soft, or something that's cold can also activate your sense of touch. Now, these steps will help you take your attention away from the flashback and the fear that it creates, and help you to relax. Now, as you practice this, you'll get better. But like I said, seek help. Now, the next one I want to talk about is PTSD. That's post-traumatic stress disorder. Now, we usually associate PTSD with people in the military, and this is not to trivialize what they experience, but anyone who suffers from a trauma can suffer from PTSD, because it's experiences of feelings of anxiety, stress, and fear. Because PTSD is an anxiety disorder resulting from a traumatic event. And survivors of any type of trauma, including sexual violence, can have these symptoms. It's associated with extreme feelings of stress, fear, anxiety, nervousness, constantly feeling like you're in danger. Which all of these symptoms make it difficult to function in everyday life. Now, the 3 main symptoms of PTSD is re-experiencing again the flashbacks, feelings like you are reliving the event over and over again in your dreams, in flashbacks, and intrusive thoughts. Also, one of the main symptoms of PTSD is avoidance, intentionally or subconsciously changing your behavior to avoid scenarios associated with the event, or losing interest in activities you used to enjoy. and kind of isolating yourself. Also, the third one is hyperarousal. You're feeling on the edge all the time, having difficulty sleeping, being easily startled, or prone to sudden outburst. Again, if you feel you are experiencing PTSD, get help. It is not something you want to ignore for your own peace and happiness. Ignoring what you're going through can lead to self-harm, substance abuse, isolation, eating disorders, sleep disorders, and even suicide. Now, again, you can find a list of crisis resources on my site. Use the link below. Also, RAINN, that's the Rape, Abuse, and Incest National Network, is a valuable resource. I have put their link below as well. It gives you some insight into how victims process the symptoms and things that they're going through after being abused, child molestation, rape, date rape, sexual harassment, sexual assault. There's insight to help you understand, to know that your symptoms are real and valid. So, that's all I have for you today. Take care of yourself and your loved ones. And remember, share this episode with someone that it may help with. Share with your loved ones and let them have some insight in how you're feeling if you've been a victim of sexual violence. Thank you so much for continuing to support the show, and I look forward to talking with you again next week. Thank you.